Good afternoon, all. I hope you are enjoying the classes. From Monday onwards, we'll be having live classes also, along with. Am I audible?
Yes, you are, Anshu. You are.
So from Monday onwards, we'll be having live classes, and we are thankful to JICP and MedTalk for our online platform. And today we are having with us Dr. Anju Singh. She is Director Professor in the Department of Anesthesia, Lady Hardinge Medical College, and she needs no introduction. And I am sure all of you know her. And she'll be speaking upon TENS, cupping, Moxibustion, and hammering, which are very important ways of delivering energy. So happy learning to you all. Dr. Anju, please.
Thank you very much, Dr. Anshu. A warm welcome to all the delegates who are listening in. As Dr. Anshu has said, today's lecture is fairly interesting. It's a simple, breezy topic. It's not very complicated. Some of us have experienced parts of this in our daily lives, either on ourselves, on relatives, on friends. And the light lecture is probably keeping in mood with the late Saturday afternoon where we don't want to burden you with too much of academics. So we'll be talking about TENS, hammering, cupping, and Moxibustion. All these techniques are part of healing used in traditional Chinese medicine. Coming to transcutaneous electrical nerve stimulation, or TENS as it is popularly called, TENS is a non-pharmacological intervention that is used in the treatment of both acute and chronic pain conditions. It utilizes a small unit, which is known as the TENS unit, which is a small battery-powered device about the size of a small cell phone. And this device delivers low voltage alternating current via certain cutaneous electrodes that can be positioned near the painful area to provide pain relief. Both high frequency as well as low frequency TENS is possible. The high frequency TENS oscillates between 80 to 120 cycles per second, and low frequency is usually 1 to 20 cycles per second. The therapy can be either unilateral or it can be bilateral. Now, various theories have been proposed for the mechanism of action of TENS, and amongst them, primarily two have gained importance. One is the pain gate mechanism, which is applicable usually when high frequency TENS is being used, and activation of our own endogenous opioid system, particularly when low frequency TENS is being used. Now, TENS activates a large complex neuronal network in our body. Large diameter afferent fibers are activated, and this afferent input is then sent to the CNS to activate inhibitory descending systems involving opioid, GABA, as well as muscarinic receptors. Specifically, it has been shown through studies and experiments that blockade of neuronal activity in the periaqueductal gray area, rostral ventromedial medulla, and the spinal cord are known to inhibit the analgesic efficacy of TENS, thereby indicating that it is these mechanisms which are activated in the TENS mechanism when it is used to relieve pain. TENS has been shown at clinically used frequencies and intensities to restore central pain modulation, which is a measure of central inhibition. Thereby, it is known in studies to reduce hyperalgesia. The other mechanism is activation of the endorphins in the body. It raises the level of beta endorphins in bloodstream and CSF, also decreases the release of excitatory neurotransmitters like glutamate and of substance P in the spinal cord dorsal horn, thereby causing pain relief. TENS produces, it activates both peripheral as well as central mechanism when it causes pain relief. Now, what are the indications where TENS has been used for pain relief clinically? It has been applied for various conditions where the patient experiences neck pain, acute non-operative pain like tendinitis and bursitis, post-operative pain, certain kinds of cancer pain, labor pain, low back pain, osteoarthritis responds well to TENS, and certain other symptoms of diseases such as fibromyalgia and sometimes in diabetic neuropathy, as well as other neuropathic pain, also find relief with the use of TENS. What are the factors which affect the efficacy of TENS when it is used? Mainly the type of population and the pain outcome that is assessed. Also, the type of painful condition for which it is used will decide whether it is effective or not. High frequency TENS is more effective for people taking opioids. So if you use low frequency TENS in people who chronically use opioids, you will find it is not effective, whereas high frequency TENS will be effective. Most importantly, parameters of the dose that is being used in TENS, that is the duration of the therapy, the pulse frequency, are conditions which affect the efficacy of TENS. Tolerance to repeated TENS and intensity of stimulation are two other factors which affect its efficacy. One of the most important factors involving the efficacy is the placement of the electrodes. If the electrodes are applied at acupoints, they tend to be more effective than when the therapy is applied over non-acupressure sites. You must also remember that there is tolerance which develops to repeated TENS. What is tolerance? The application of TENS repeatedly, either high frequency or low frequency, at the same frequency with the same pulse duration daily tends to produce analgesic tolerance. This analgesic tolerance by low frequency TENS results in cross tolerance at new opioid receptors in the spinal cord, and analgesic tolerance by high frequency TENS can also result in cross tolerance at the delta opioid receptors. Now, how can this tolerance be prevented? Both pharmacological and non-pharmacological modulation can be used to prevent the development of tolerance to repeated TENS, specifically by blocking NMDA glutamate receptors. Also, if you modulate between high frequency and low frequency TENS in the same treatment session, the results tend to be better. Also, if you vary the intensity of TENS and increase it gradually, you will have a more effective therapy session. Intensity of stimulation that is utilized is critical to the outcome, and it is the commonest cause of failure of therapy. So using the strongest intensity that still is comfortable to the patient will result in better outcomes as compared to lower intensities, which may sometimes be ineffective in a certain category of patients. Why is high intensity more effective? High intensity in TENS is known to activate deeper tissue afferents, allowing for greater analgesia, and activation of a greater number of sensory afferents also improves the outcome. High intensity TENS in various studies has been shown to decrease the postoperative opioid requirements. So it is recommended that when you apply TENS, you should apply it at the maximum tolerated intensity for each patient to be more effective. What are the advantages of this kind of TENS therapy? Most importantly, it's a simple, invasive, and inexpensive method of therapy. It is safe with very few reported side effects. The TENS unit is small and portable, can be easily used anywhere, anytime, whenever the patient requires pain relief. Pain medication can be effectively reduced in conjunction with the TENS therapy. It is a patient-friendly intervention. Are there any disadvantages? Yes, occasionally these electrical impulses can cause an uncomfortable buzzing, tingling, or prickling sensation, and some patients have developed and reported an allergy to the adhesive used in the TENS pads. Are there any clinical conditions where TENS should not be used and it is contraindicated? Yes. If you have an implantable device, that is something like an external defibrillator or an implanted pacemaker, then that device can malfunction with the application of the TENS current, and it should not be used in these patients. It should not be used in pregnant patients, particularly applied to the pelvic area, abdomen, and lower back. If the patient has any known or suspected cancer tissue or any tissue which has been subjected to radiation recently, it should not be used. If the patient has known epilepsy, do not apply TENS electrodes, particularly to the head, neck, or shoulders, because the impulses can precipitate seizures. Any history of deep vein thrombosis or thrombophlebitis is also a contraindication to using TENS, because this increase in blood circulation can increase the risk of dislodging a blood clot leading to complications. Any bleeding disorder, if TENS is used, increases the risk of bleeding and is a contraindication. If the patient has heart disease, do not apply it, particularly on the chest, because it can precipitate arrhythmias, and it should not be used near genitals, should not be used on irritated, fragile, damaged skin, and should never be used in the head and neck area or close to the eyes and mouth. There are certain studies which are available regarding the use of TENS for pain relief. This is a study published in 2014, which is basically a systematic review, and majority of the systematic review and meta-analysis have indicated that high frequency and low frequency TENS does provide some amount of analgesia, particularly when it is applied at a strong, non-painful intensity. This is what a TENS machine looks like, and this is the electrodes being applied at various body points, neck, back, legs, near the knees, for it to be effective. So, 2 points to remember about TENS is that it is known to provide analgesia at strong, non-painful intensity, both high frequency and low frequency, particularly when they're applied for the right indication. There are systematic reviews available in literature regarding TENS and has shown to produce pain relief in conditions like diabetic neuropathy, osteoarthritis, and fibromyalgia. Effective analgesia in TENS can be limited by the development of tolerance to TENS. Application of TENS and TENS electrodes at acupuncture sites tends to increase its efficacy, and TENS is known to be effective in restoration of central pain modulation. The next topic in sequence is the use of hammering for pain relief. Now, hammering has been used in traditional Chinese medicine for a very long time. A wooden or a plastic mallet is employed by the therapist, where the therapist uses this hammer or mallet to tap the hammer head onto the skin, which tends to produce vibrations which are known to resonate and penetrate through deeper layers of tissue and bones. Commonly, a hammer head is made up of 5 to 7 needle clusters. These are plum blossom needles, and this is known either as a 5-star or a 7-star hammer. Now, this hammering actually stimulates blood flow in the affected area where it is used, and also tends to release endorphins like all other traditional Chinese medication therapies. The technique of doing TENS doing hammering is that you use the selected area, then take the hammer and strike it perpendicular using your wrist movement. It has to be a perpendicular, gentle movement where the hammer is used, using the movements from the wrist for it to be effective. Hammering can be light, medium, or heavy. The applications where use of hammering has been described is post-stroke paralysis, treatment of migraine, sometimes asthma, rheumatic disorders, hair loss, leukoderma, dermatitis, etc. It's a wide variety and very diverse indications where hammering has been used for effective therapy. The contraindications for hammering include the presence of trauma at the site. You can't obviously use this for pain relief if you have fractured areas, you have damaged skin, you have open wounds, ulcers, burns, infections, even varicose veins. Now, this is what a hammer looks like. And as you can see, the hammer and mallet is being used, and wrist movements are recommended when you do this kind of hammering therapy, particularly effective for chronic pain relief, in chronic conditions. Next, we come to a very interesting therapy called cupping. Cupping is also known as cup therapy or suction cup therapy. You may have come across pictures like this in various textbooks. Now, cupping is actually a method of stimulating the acupuncture points by applying suction through a hollow vessel into which some vacuum has been artificially created. It is performed by applying cups that can be made of glass, bamboo, ceramic, plastic, or even silicone these days. It can be classified either as a wet or dry therapy. We'll be explaining this a little later. The common application sites are back, chest, abdomen, buttock, and some other areas where the muscle is abundant. Now, what actually happens in this cupping therapy? Now, you take a cup which is usually made of glass or silicone. Into this cup is put of inflammable substance like alcohol, sometimes paper, combined with herbs, and they are set on fire. As the fire slowly goes out, the mouth of the cup is placed firmly upside down by the therapist on the skin. As the air inside the cup cools, it creates a vacuum and then a suction effect, which pulls the skin upwards into the cup. The rim of the cup is usually rolled not only to make it smooth, but also to ensure a tight contact with the skin so that the negative pressure that is so created is well preserved. Sometimes lubricants may be used on the skin to facilitate the movement of cups over a larger, wider area. In wet cupping, what is done? In wet cupping, once the cup is put, in the second instance, after the fire goes out and vacuum is created, after a little while, the cup is removed. Small, light, tiny cuts are made on that area of the skin with a scalpel. And then a second suction is done to draw out a small quantity of blood after the cup is applied on the skin. Traditionally, cupping is done in sets of 4, 6, or 10 cups, and each session usually lasts for about 5 to 20 minutes. Now, what is the exact mechanism of action? It's never really well understood, and multiple theories for its effectiveness have been put forward by modern science, as has been done for other traditional Chinese medication therapies. The pain gate theory, the conditioned pain modulation may be effective in its effectiveness. Immunomodulatory effects are known to occur. But as per the traditional Chinese medicine, it is said that there is an increase in blood circulation. The suction force expands and breaks open capillaries under the skin when the cup is applied. This replenishes the cupped area with healthier blood flow and stimulates healing at a cellular level. It is also said to remove toxins and waste once a suction is created and blood flow is stimulated. Now, cupping therapy can be classified on various heads. Technically, it can be classified as dry or wet cupping, as needle cupping or massage cupping, depending upon the technique which is used. The power of suction can also be used to classify the type of cupping, light, medium, or strong pressure, and classification is on the level of negative pressure created. The method of suction used to create the negative pressure inside the cups can also be used for its classification. That is, you can have cupping which is created by manual cupping or electrical vacuum cup. The use of additional added therapies can also be used to classify the cupping therapy. You can have needle cupping, you can have laser cupping, you can have electrical cupping, you can have water cupping. Now, there is some amount of literature available regarding cupping in published literature. This is an interesting systematic review published almost 10, 12 years back. In this systematic review, 7 RCTs were included, which showed a positive effect of cupping in cancer pain, in trigeminal neuralgia, and in backache. And when compared with anti-cancer drug and analgesics, it was said to have a beneficial effect. However, none of these trials were of very high quality. And it was recommended by the authors that more rigorous studies are required to definitely conclude that cupping is an effective therapy. The common indications are low back pain, arthritis, neck pain, cervical spondylitis, postherpetic neuralgia, carpal tunnel syndrome, fibromyalgia, certain gynecological disorders, also infertility, and it has been used in headaches, migraines, and for the control of hypertension. What benefits does it offer when it's used? It encourages basically whole body comfort and relaxation, increases the pain threshold and is said to reduce inflammation, enhances blood circulation, thereby reducing toxins from the body. By enhancing comfort and relaxation, and because of positive changes in the body circulation, it is said to reduce cholesterol and low density lipoproteins, thereby helping to prevent cardiovascular diseases like atherosclerosis when regularly used. It helps to stimulate the peripheral nervous system. Cupping has always been recommended, remember, as a complementary therapy, not as a sole therapy in any of the painful conditions. There are certain contraindications to its use. You cannot use cupping if bleeding disorders like hemophilia are present, if you have patients who have pacemakers or external defibrillators attached, you should not use it. Active infection like thrombophlebitis or the use or any other scars or psoriasis, in those conditions, it should not be used. Fracture sites cannot be used. Deep vein thrombosis, thrombophlebitis, it should not be used in pregnancy, purpurium, and preferably avoided in children. What are the complications of this kind of therapy? There can be complications locally produced as a result of application of the cup. You can have burns, you can have bruises, you can have scar formation, bulle formation, occasionally pruritus and skin infections and abscesses can be created. Some systemic effects have also been reported like vasovagal, dizziness, nausea, vomiting, etc. And there is a definitive risk of infection, bloodborne infections like hepatitis B and C being spread through the use of these cups if they are not well sterilized when used on one patient and from one patient to the other. This is what a therapy session looks like. You can see that the cups are applied on the back, which is a large area with abundant muscle. And because of the suction, you can see that some amount of skin and tissue is drawn within the cup as a result of the suction that is created. Now we come to last part of the lecture, which is equally interesting. This talks about a method of pain relief, which is known as Moxibustion. We frequently use it in the department. I have personally used it on myself and can vouch for its efficacy and efficacy in pain relief. Now, this is a therapeutic method of treating diseases by burning moxa wool at specific acupuncture points. Now, this therapy has existed unchanged for more than 2,000 years. It is actually named on the mugwort plant, which in Japanese is called as mugosa. So from mugosa, you have the word Moxibustion. Now, the leaves of these mugwort plant can be dried and then ground into a wool. And this wool is then clumped together to form various shapes, such as a ball or a stick or a cone. And this is known as the moxa stick. Now, there is a little difference between traditional Chinese medicine, to which moxa belongs, and the actual use of Moxibustion. Umbilicus is a point which is commonly used in moxa therapy, and it is traditionally not very commonly used in standard traditional acupuncture. Now, practitioners believe that this heat which is resulting from the burning of moxa actually stimulates the acupuncture points and improves the flow of qi in the body. It disperses cold, it warms you, it dissolves the stagnation energy. And when it is combined with the traditional Chinese meridian system, the physical and chemical effects of Moxibustion together produce a comprehensive healing therapeutic effect. Moxibustion can be direct or indirect. In direct moxibustion, a small moxa cone is directly placed on the skin at an acupuncture point and ignited. Again, this direct moxibustion can be of two types, scarring or non-scarring. That is, it is placed on the skin to create a blister and a scar in scarring moxibustion, and can be placed in the skin but removed a little while later to prevent the absence of a scar. This is what a picture of a direct moxibustion looks like. You can see it being placed directly on the skin and it being burned so that heat is produced along the traditional Chinese medicine or the acupuncture meridians, which you will be made familiar with in the coming classes. Indirect moxibustion is more commonly used. In this, the moxa stick is held 1 inch away from the skin. You can see in this picture as to what an indirect moxibustion looks like. This is a moxa stick which is burnt, and this is held a little away from the skin. It can also be placed on acupuncture needles, which allows the heat to travel to the body through the needles. It can be put on another therapeutic material such as ginger or garlic or even salt, which is placed onto the skin first, and then a small piece of moxa is placed on this therapeutic material. It is then ignited and left to burn. It is usually burnt till the area turns red and you can feel heat till it's no longer felt comfortably. These are the pictures as you've shown. On the right-hand side, you can see that moxa is put on another therapeutic material like a bamboo stick, and then it is ignited to create heat along the acupuncture points. Clinically, moxibustion has been known to provide pain relief in conditions such as arthritis. It has been used to provide pain relief in injury, digestive problems, irritable bowel syndrome, ulcerative colitis, menstrual irregularities. It has been used to treat infertility. There is a lot of literature where the use of moxibustion has been used in the beginning of 3rd trimester to actually to treat the breech pregnancy. Contraindications, of course, use of moxa is not recommended in hairy areas and scalp region. You really don't want a patient whose head will catch fire. It should not be used in the facial regions, in the genital organs, close to sense organs like the eyes and the mouth. It should not be used in ulcerated areas, next to areas which already have a sensory loss, because then the patient will not be able to tell you if the heat is too much and a burn may occur. It should not be used on children, on debilitated patients, on patients who are mentally deficient. And if there is known sensitivity to smoke, or if smoke is known to precipitate asthma, then this should not be used in such patients. What are the potential complications? There is obvious risk of getting burnt. They can have a toxic reaction to the components of the mugwort wool. Nausea, vomiting can be precipitated. Some coughing can be induced by the smoke. As a result of carelessly done moxa, you can have dark patches on the skin. And even basal cell carcinoma has been reported due to frequent use of moxa at a single point. Literature is available regarding the use of moxibustion, and it has indicated that moxibustion provides pain relief for the indications which I have already mentioned. Now, to summarize, these kind of therapies such as cupping or TENS or moxibustion are part of traditional complementary therapy. They are easy to use, simple, and relatively inexpensive. The benefits, however, are sometimes difficult to measure, but people have found it useful in a wide variety of painful conditions. Since it has few side effects, it may be worth giving it a try if you are having trouble controlling pain with more conventional methods in your patients. However, they are not to be used as a solitary therapy, but can provide effective relief when they are part of an integrated care plan. Thank you so much for patient listening. I hope you have a very happy learning experience. Thank you so much.
The next lecture which Dr. Nitin was supposed to take, he has to go on some assignment, official assignment, and he could not send the recorded lecture. So it will be taken up sometime later. So we can ask any questions or any problems if you have right now. We can discuss that.
Any questions I'll be happy to answer.
So good evening, Dr. Ranju. I am Dr. Sushil from
नमस्कार
Bhatinda.
सुशील सर, कैसे हैं?
बस सर मैम बढ़िया.
So good to see you here.
After a long time.
जी सर.
आपने जितना बताया, how much you people are practicing these things?
See, sir, TENS is being practiced. It is not part of a solitary therapy. कभी भी ऐसा नहीं होता कि by itself therapy दे दी, but usually chronic pain के patients जैसे osteoarthritis के patients हैं, they come to our pain clinic, so they are already on medication, and they can be given these supplementary therapies while maybe they are being investigated or other therapies are being planned. This can only be an ancillary therapy. Moxibustion, of course, I can tell you, I've used it on myself. I had very bad torticollis at one point of time. And if you were there yesterday and you listened to Dr. Kohli, he was the therapist who administered Moxa to me. It is very useful. So, sometimes acute conditions like acute back pain, acute osteoarthritis, they are helpful. Moxa is really helpful. A couple of sessions actually brings relaxation. The heat therapy helps. So they are being practiced, but not as standalone.
Sole practice.
Yeah, not as standalone therapies. They can be practiced. The patient can take a TENS home. You can teach him how to use it, and while they are active in the metro, on the bus, at work, the TENS can continue to work in addition to probably their oral medication. If they are on antidepressants along with the oral medication for their chronic pain relief therapies, then this kind of therapy helps. And additionally, since this is part of what I know as traditional Chinese medicine, you have to believe in the therapy for it to work. That part forms a very essential component of the therapy being successful.
Yeah.
Moxa on acupuncture points is also very, very useful.
So where do you get this material from? Moxa material, where do you get it from?
Sir, Moxa material is very easily available. बहुत सारी shops हैं जहाँ acupuncture की needles मिलती हैं. वहाँ Moxa sticks easily मिलती हैं. हम सबके कमरों में जो हम लोगों ने ये कोर्स किया हुआ है, हम सबके कमरों में अलमारियों में एक Moxa stick का डब्बा रहता है और हम एक दूसरे पे Moxa करते रहते हैं अक्सर अगर हमें जरूरत पड़ती है तो.
And one more, the TENS can be used in post-operative period also along with other therapies. And Moxa is useful at places where acupuncture is contraindicated. That is another usefulness of Moxa.
I will try this out.
You have patients who are on anticoagulants. Although no therapy is recommended for these patients, जैसे TENS भी नहीं use कर सकते, acupuncture भी नहीं use कर सकते, उन patients के लिए भी Moxa useful रहता है.
And we'll be doing demonstration of Moxa also later on.
Yes.
Right. Thank you.
Welcome, sir. Any other questions? Okay. Thank you so much.
So I think we can end the session here if there are no more questions, and see you on Monday then.
Okay, thank you so much, Dr. Anshu, and thank you to Clernet for providing this platform.
And it's not Clernet this time, it is MedTalk.
Sorry, yes. Thank you.
Dr. Anju for joining us.
Thank you so much.
Okay.
Thank you so much, ma'am.
So-
We are closing with all your permission. We are closing here. Hope to see you on Monday.
Yes.
Yeah.